Chapter 11 talks about the Affordable Care Act, which was put in place to help with access to health care insurance. And it was also put in place to protect patients from unfair insurance practices, which is also very important. And also, something else that goes along with that is the fact that the chapters before talked about that a lot, so everyone knows a lot about that. It was also put in place to improve healthcare quality and to reduce costs when it comes to healthcare services, which is also very important, as we know, because everyone's not fortunate to be able to fully cover their healthcare services. It also talks about the Mental Health Parity and Addiction Equity Act, which was put into place to ensure health insurance coverage for mental health patients and substance use disorders. Another very important policy that was mentioned in this chapter is the Fair Housing Amendments Act. This policy was created to prevent housing discrimination. The last policy talked about in this chapter is Americans with Disability Act, which prohibits discrimination against people with disability. And when it comes to the ACA's 80-20 medical loss ratio rule, we all know that it requires people to spend at least 80% of premiums on patient care. It was designed to protect customers. And also, something else that's very important is it has to do with the incentive. As like total healthcare spending increases, people can retain a percentage of a larger pool, which can benefit them from overall costs of healthcare services. I agree with this argument, but I also don't at the same time, because I feel like motivation can be reduced from, the overall cost being having to be paid for. And it can also cause like false claims, which can cause a fear of litigation for denying care under, priority laws. They also may prefer a pay first, review later approach to avoid like not getting access to addiction treatment. And also, insurers were likely to be unprepared for, the expanded coverage under the ACA when it comes to like behavioral health, which had like less controls, or they knew, less things about back then. When it comes to this fraud schemes, I believe that coordination between the federal and state authorities is very important. For example, like places like Centers for Medicare and Medicaid Services and Department of Justice, they can expand data analytics to detect abnormal billing patterns and increase enforcement actions against bad actors, which is very important. Because like I said, we talked about this in the other chapters. We talked about how like people were tricking people into thinking that they were getting certain things just so they can, use their insurance and be billed for the companies to make more money. When it comes to like state and federal authorities, the states can implement stricter licensing and oversight of sober homes and testing labs, which is also very important because, as I said, we talked about this in the earlier chapters. There were a lot of like fraud and everything going on when it comes to the sober homes and testing labs. For example, they talked about like people getting their urine checked for no reason, basically just so they could make more money. When it comes to like their insurance, they adopt a more proactive pre-authorization and real-time auditing systems, meaning like it goes more in depth. reducing fraud, I feel like, requires balancing accesses to care with accountability, like being safe and making sure patients have the treatment that they need without like people being exploited and people being billed for no reason, basically, just so the insurance companies can get money. Thank you.